Now to the growing push for COVID booster shots. The state expanding eligibility to let all adults get another dose. So what's behind the new push and how easy is it to get that third dose?
We want to bring in Dr. Aimee Sisson, the public health officer for Yolo County. Dr. Sisson, good to see you on this Friday. A two-part question to start off here. Is the push for boosters because of waning immunity or concern about a winter surge? And what would the impact be if everyone who could get a booster shot actually did?
Yeah, I think it's really all of the above. The available vaccines that we have are great, especially for preventing severe disease, hospitalization, and death. But the protection against infection does wane over time. And so to protect everybody, especially those who aren't yet vaccinated, including children 0 to 4 and most of our children ages 5 to 11, we need to reduce transmission. And that means getting our case rates down. And getting more people booster doses will help get our case rates down. We are concerned about a possible winter surge, like what we're already seeing in parts of Europe, including Germany, where there's a similar mix of both unvaccinated and unboosted persons who are able to transmit disease. So now is the time to act to get more people their first shots and their boosters before we start gathering for the upcoming holidays.
So, Dr. Sisson, demand for boosters has been kind of lousy, right? Only 34% of seniors statewide have gotten one. How worried are you? And why do you think there is that hesitancy?
Yeah, I think honestly the messaging about who's eligible for booster doses has been terribly confusing. We started out talking about certain groups who should get a booster versus certain groups who may get a booster, and it's just been way too complicated, and we recognize that in public health, and we're hoping to make things more clear moving forward. So if you feel like you're at risk of COVID exposure and you want additional protection from a booster, you can now get a booster.
So who's responsible for that mixed messaging? CDC?
I think it's coming from all levels of government, but it started with CDC.
So, Dr. Sisson, we know a lot of our viewers who've reached out to us have had issues making and booking those appointments to get those booster shots if they don't fall under those CDC guidelines. So is the county directing clinics and pharmacies to perhaps change that criteria, or do people just need to lie to get these shots?
Yeah, so the state public health officer issued a letter to all vaccine providers in California on Tuesday, asking them not to turn away people who are seeking boosters who are 18 and older, and they've had either 2 months after a Johnson & Johnson or 6 months after a Moderna or a Pfizer vaccine. And I've relayed that direction to all of the providers who are getting vaccine from Yolo County Public Health. There's many factors that can put someone at increased risk for COVID-19 exposure, and we want to allow individuals to self-attest that they're at increased risk and qualify for a booster. But right now, some of the registration forms that providers are using haven't quite caught up with this expanded interpretation of eligibility. And so some people may want to add their own checkbox to the registration form that allows them to attest to their own risk as well as eligibility.
All right, Dr. Sisson, thanks for your time, and hopefully we'll get some clarity and everyone get on the same page here. Appreciate it.
Thank you.